really nice to be here. Thank you, Duncan and Henny and everybody here. It's also very nice to see so many faces that I know, who I actually got to know over a long time. This is actually not part of my talk, but I really think that I'd like to share this with you. And with the praise and worship, I think it's important that I say this, and then I'll get to the talk. So, a couple of months ago, I got a phone call from a professor in Cape Town. He's at the university, and I answered the phone, and he says, "Dewald, I think I need an operation, and I want you to do it, but I can only come on this day or this day, and it's like 8 weeks, because then everything is sort of okay, and there's no chaos, and I'll be able to come on those days. Can we make it happen?" Oh, yeah. First I go pale, and then a sweat on my forehead, because I know this guy, and he wants me to do an operation. I haven't seen him for quite a few years, so what is this operation? But discussion ends there over the telephone, and he comes for his consultation, and lo and behold, he needs an operation. So we book him in on that exact day that he wanted to come. Then we do the operation, and with a lot of prayer, that everything goes perfectly fine. And yesterday afternoon was his follow-up consultation with me. And the whole day I see that the people in the practice are sort of like cleaning, getting everything ready. And at one point I said, "What are you guys doing?" He said, "The prof is coming, so we have to be ready." Yeah, okay, just follow up. Yeah, all right. So 4 o'clock, last patient. And he comes in, and I have a look at his little wounds. Everything goes fine. He's back at work. He's back to his busy life. And we have a chat, and we started talking, and this and that. And then in the end, he said, "May I pray for you?" So that gave me hope. Because this guy from Constantia, influencing decision makers around COVID, the parliament, these task force, influencing first-year students at the university, prayed for a silly guy in his office on a Thursday afternoon at 4 o'clock. So that gave me real hope, and I think we're on the right path. So, Duncan. At the moment, we're looking at the numbers in South Africa, and we actually worried again. The facts show that the numbers are increasing. It's not a proper surge yet, but in places like the Garden Route, there's a proper surge going on, and they have numbers now higher than what they had when we had the June and July peak. With us in the Western Cape, it's under control. But I've seen the action plan yesterday morning from the Western Cape government, and it's a really, really detailed action plan. I'm so impressed with what those guys did that I wish I could share everything. After reading through all those documents and slides yesterday afternoon, I actually phoned them and said that I'm really impressed with what they're doing. It's amazing to read through and what they've done up to the moment. So yes, numbers are rising, and we might have a second surge, but I think everybody is ready, so it's not going to be as bad as it was in June, July, because we know a lot about it, and we'll be able to handle it better. And then I also thought that it's worth mentioning that in South Africa, we're actually not doing that bad. So if we look at something that we can compare with other countries, then we look at the number of official COVID deaths per 100,000 population. And in South Africa, that number is about 28. And that leaves us to 27th in the world, or 27th highest. But it's much better than the other countries, like Spain. It's about almost 100. The US is 64. The UK 62. So we're doing really, really well if we're looking at those stats. It's not as good as Germany, for instance. They're on 11.5, but we're on par with all the first world countries in the northern hemisphere. And then Duncan also asked me to maybe just say something about the vaccine that we are sort of promoting, and in the last couple of weeks you would have seen lots of new articles on that. And this was one newspaper article that said the Oxford University vaccine is highly effective, and it's now been sort of tested. They see the numbers, so there's hope. The vaccine is actually there, it's working. So it's reported to have a success rate of about 70 to 90%, which doesn't sound that great because we wanted 100, but in terms of vaccines, that's actually really, really good, and we can look forward to the day that it's enrolled. So we're very excited about this. There are 4 companies, 4 vaccines. They all work on a dosage of 2 jabs or 2 dosages a month apart. They're very effective at the moment, and they need to be stored. So in a warm country like South Africa, and with our rural areas, the top one, the Oxford one, might be for us. It's also going to be the cheapest one. I read that it costs about £3 to get. Might get it in South Africa for about 4 or 5 rand, and the others are quite more expensive, goes up to about £25 per vaccine. And then we also get excited about these things. So the day that the Pfizer study was released, they saw a massive increase in their share price within half an hour. So it really works. But it will also bring us new problems. Qantas has just said in the week that you won't be able to fly with them if you've not vaccinated. So that brings about a lot of problems, ethical dilemmas. What if you don't want the vaccine? What if you had the COVID? So this whole thing about immunity passports and ethics, that's going to be a big problem for us next year. We're not excited about the paperwork. So once the vaccines are available in the rest of the world, it doesn't mean, unfortunately, that it's going to be available for us. We'll have to go through this whole regulator thing, and just because the FDA in America has approved something doesn't mean that it will be the same for us. So we might have to fly, get our vaccines and come back, and then later on we'll have it freely available in South Africa. But we hope that this process is a lot quicker this time around than what it normally is with new medicines in South Africa. And that brings me to why we're here today. So with this topic beyond COVID, I was really puzzled about how one should approach this. And I think we should, for this next half an hour, talk about looking beyond COVID and then recognizing something called long COVID. And I'll explain as we go on. So 2020 is an interesting year, Tanya. Lots of stuff happened. We can all agree that these masks, this I'll remember as my dislike of the year. Is I can't see people's faces, and I hate wearing them. What I realized this year is we are not in control. No, we think we are. We're not in control. What did I like about this year? Well, I liked the fact that this year highlighted the importance of personal and public health and health structures in the world. Because without that, everything fell apart. And it was left behind. Social media was up there, everything was up there, technology and public health went down. But do I think the world's going to change? I'm not so sure. We'll see. So business in my world at the moment looks a bit like this. 86% revenue losses, groups closing down of hospitals, 2.3 billion loss for another big group, and these are all publications in the last 2 weeks on News 24. So from a business perspective, the world in medical care, as we know it in South Africa, has been turned around a bit. But in the same, Discovery, health insurance, and Pfizer, I don't think has ever been in a better position than they are at the moment, with the surplus that they've got in their share prices. The storm is coming. So that's how I felt in January and February, and that's how all my colleagues felt in January and February. We were reading these things, we saw the videos, we saw what was happening in Italy, and we were sitting there preparing, getting PPE ready, preparing the hospital because the storm is coming. And it really felt like we were sitting there and waiting for that storm to hit us. We just didn't know how hard it will hit us and exactly when. And that made me think of this tale of a farmer that replied to the question, "What do you do when there is a storm?" And he answered, "I go inside and I sharpen my tools." And I think that sort of happened to us in that time. We had to go inside, we had to lock down, we had to self-isolate, and we had time to rethink, to read, and just to make sense of this whole running around in our world each and every day. But we have to ask ourselves the question, why were we so afraid? And we were not afraid of the virus, but we were actually afraid of death itself. And that we have to think about every day. So we are here today for a specific reason. None of you are just here for the fun. You're here because you should be here. You made a choice, I made a choice, Duncan made a choice. We are all here for a specific reason. We chose to be leaders in our different fields. Faith, business, education, in our families. And we chose to come here today to be empowered, to learn from each other. But with this empowerment comes responsibility. So we have to go out of here with added responsibility. Responsibility to help the other people around us, to carry them through if they were hit harder than us in this difficult time. And also responsibility to inspire and empower these other people in these funny times that we are living in. So the storm came, it hit us, but the storm is still here. It's not over. And my wish for all of us today is that we'll go and we'll sharpen our tools. While I was preparing for this talk, I really struggled to sort of focus my mind on a chronological order of what I wanted to say. And what kept on coming back in my mind's eye was the first day that I had to operate on a sick COVID patient. And I remember it very, very well. I actually remember which theater I operated, what time of the day. I actually remember where I put my shoes on and where I put my shoes back afterwards. And I remember it so well because I had to put on this new PPE and it looked like a virus fighter. I could not talk to my patient because he was too sick. He's never seen me. I could not speak to him and discuss with him what I'm going to do to him. He was intubated. He was too sick. The family wasn't allowed in. So we had a telephone call with them. And I didn't know what the outcome of this procedure is going to be, because the outcome for this patient was already really poor. Now I'm going to do an operation on him, so it sort of must be even worse. And these things made me feel unsure. It made me feel afraid. It made me feel anxious. I was nervous because I didn't know what to expect and what the outcome is going to be. And I felt like that lady surgeon in the top corner. I felt pathetic. I was shaking before I had to go in there. And I had to pull it together. And so much more for the other people that are in and around us. Because this thing I've done 1,000,000 times. So I should not be, but it was. And I remember that every day. And then in the hospital, in that time, we were not only fighting the disease, we were part of a spiritual warfare. We saw souls lost and won, and we were part of it. And maybe we're fighting for our souls as well at that point. And I'd like to share with you that in that time we formed a Bible study group over Zoom, and it just consisted of husbands and wives, and they're all doctors going through the same time and thing. And it was so great to get together, even though it was on a screen, and just to carry each other through and to get some strength from the other person. And the day that you felt strong, you carried the other guy. And the guy that you felt really weak, they carried you. And it was precious. And our Bible study group still going on over Zoom. So, in the end, every morning when you leave home, you had to prepare. You had to prepare. We had an outside room where you get dressed with your working clothing, then you get dressed again, then you shower, you see patients, then you shower outside when you get back home, and then you put the clothes on, and then you get allowed inside home. So we had to prepare. But we also had to prepare for this battle of spiritual warfare in the hospital. And I did that by putting on the armor of God. And by doing that, it allowed me, after that first pathetic little 10 minutes, that I never felt so unsure and nervous before an operation, ever, to move from that nervous surgeon to this Roman soldier that just felt he could do anything. And it was amazing to feel like that and to feel like this in the space of a couple of minutes. But it's not me. I did nothing. I just had to look up. So in order for us to be of any use in and around our communities at present, we need to know a little bit about COVID and this new term, long COVID. So allow me a few minutes to explain what I mean and how we can help our friends, families, co-workers, and staff. So we need to be able not only to deal with the acute COVID infections that we have, but we also need to recognize the signs of long COVID in the people around us. So every day, outside the hospital. So COVID-19, the acute infection, it's got 4 scenarios. Now you get the virus and you don't get sick. You get the virus, you get a little sick. You get the virus, you get really sick, but you recover. And you get the virus, you get really sick, and you don't recover, you die. And these 4 scenarios left us with 3 big problems during and after COVID. And the first big problem is the traumatic loss of loved ones due to the acute infection. It was unexpected, nobody had time to say goodbye, and the person is gone. The other thing that happened was marriages and relationships stumbled because there was loss of security, loss of trust. And then the big thing that happened is businesses had this massive financial loss due to lockdown and people not able to work and trade not able to go ahead as planned. And we know these things and we can handle them because we're at the point now where we can. And now we have to focus and look beyond COVID. And now we have to recognize long COVID. So I think this term will become more and more relevant in our everyday lives, especially where we work. It's defined as an ongoing syndrome of symptoms in people that they experience after the acute infection. And in recent studies, and the best thereof is in the British Medical Journal, emphasizes the symptoms of profound fatigue, a cough, breathlessness, muscle and body aches, skin rashes, headaches, and relapses. And this keeps on going on and on and on. These people just don't get better. And this can happen in the severely ill patients, the ones that had to go to ICU and recovered, but it can also happen in a mild group, and it just doesn't want to go away or get better. So there are 4 syndromes that we look at with this new disease or definition. It's permanent organ damage due to the lungs and the heart, due to the actual virus that damages your lung tissue or your heart muscle. It's the post-intensive care syndrome. You can think, if you lying in bed, not being able to open your eyes, kept in a coma 3 or 4 weeks, and once you recover, we need to go through a rehabilitation program because you can't swallow, you can't eat normal food. You have to learn to swallow and eat again, to chew again. You have to learn to use your hands. You have to learn to walk again. So these things take a lot of care and time. The post-viral fatigue syndrome, which is going to be our biggest problem in the normal community, and then continuing COVID-19 symptoms. So, but what does the individual experience? So, it's all good and well that we can write these things in the journals and we can look for them, but what does an individual experience when they go through this whole thing? So they experience depression. Is they just not getting better? Helplessness and disappointment because they're not getting better and people think they're lazy and you should have been back at work already, but just can't. At 3 o'clock in the afternoon, they're tired. They can go through anxiety and sleep disorders, and they can develop post-traumatic stress disorder. They have smell and taste loss that can go on for ages. They have muscle and joint pains, kidney failure that requires dialysis or treatment 3 times a week, lung injury, so they can't exercise anymore, can't run around with your kids, and they can have ongoing heart muscle pathology. And all these things together will have a knock-on effect at work, at school, in our households. You can just imagine if you combine 2 or more of these things mentioned at the top, what these patients or people must go through. But is this really relevant to us? So King's College in London did the best research on this, and they said that 1 in 7 people with COVID will have symptoms for 4 weeks after it. And 1 in 20 for about 8 weeks, 2 months, but 1 in 50 will have symptoms for longer than 12 weeks, so for longer than 3 months. So if a staff member is not at work for longer than 3 months, that's an issue. If a teacher can't go back to a class for longer than 3 months, that's an issue. Globally, we've just got over 60 million cases now, just under 1.5 million deaths. If you work it out on a ratio of 1 in 50, it gives us 1.2 million people at any given time that will suffer from long COVID syndrome. So I predict that this is going to be the biggest thing that we're going to deal with in the next 12 to 24 months. How are we going to deal with this? The first important thing is that we need to know about it. We need to recognize it. So this guy, Dr. Merrill Sosman, said, you see only what you look for, you recognize only what you know. And they taught us this at med school very early on. So if you don't know about these things, you're not going to recognize it not in your friends, with your family, not in the people that work with you. And how can we help them? We have to recognize them. We have to be kind to them, because it's a real entity. They're not just lazy. We can build support groups, Bible study groups, like in my case, wellness programs. We can make them part of research groups that will allow us funding so that we can fund the wellness programs and the support groups, and obviously the vaccination and the vaccination trials. That will be ongoing for the next 10 years, and that will also fund our efforts. But in all honesty, when we're faced with a crisis, this is where we should be going to first. Not the BMJ, but this. And I don't think I can say it better than how this message got across from Pastor Gene or Eugene Whitehouse, who wrote, "Whenever we feel overwhelmed by the chaos and difficulty of life, we can turn to God in prayer for peace and serenity. In this time of uncertainty, fear, seclusion, and separation from what we term normal, our human solution is to handle it ourselves. But that is not what our Bible and the Lord tells us. Turning to the Lord should be our first response, not our last resort." This is one promise in the Bible. In Romans 8 verses 18 it says, "The sufferings of this present time are nothing compared to the glory that will be revealed to us." I'll end off with saying that William Osler said, "The good physician treats the disease. The great physician treats the patient who has the disease." The world needs us, you and me here, to go out there and to be those great physicians. Thank you.